Hello guys, welcome back to my channel. So in this video we are going to discuss the segmental anatomy of liver. So this video is all about the liver segmental anatomy according to the Couinaud classification. So according to the Couinaud classification, liver is divided into 8 segments, okay, via 3 vertical planes, and the horizontal plane is formed by the left and the right portal vein. So these 8 segments are actually functionally independent of each other, okay. Why? Because they have separate branches of portal vein, hepatic artery and biliary radicals at their centers, and they have separate venous drainage via hepatic veins at their periphery. These 8 segments are functionally independent of each other, okay. So the vertical planes are formed by the middle hepatic vein, dividing the liver into the right lobe and left lobe, okay. Next is the right hepatic vein plane, okay, which divides the right lobe into the anterior and the posterior segments, and the umbilic plane, okay, this is the umbilic plane that divides the left lobe into the lateral segments and the medial segments. Mind you, this umbilic plane is not according to the left hepatic vein, but actually along the falciform ligament, running between the falciform ligament and the IVC, okay. So these are the 3 vertical planes. Next is the horizontal division. This is by the upper and lower division is by the left and the right portal veins, okay. So left portal vein divides the left lobe into the superior segments and the inferior segments, and the right portal vein divides the right lobe into the superior segments and the inferior segments. This right portal vein is at a level lower than the left portal vein, okay. So the nomenclature according to Couinaud classification is clockwise: segment 2, 3, then 4, 5, 6, 7, 8, okay. Clockwise classification, 4 is divided into 4A and 4B, okay. So these 4 belong to the right lobe and these 4 belong to the left lobe, and this division is, this right versus left lobe is by the middle hepatic vein, or we can say the Cantel's line, this Cantel's line, which is along the same plane of middle hepatic vein running across the gallbladder fossa and the IVC, okay. Segment 1 is actually the caudate lobe of liver, which is situated more posteriorly and so not visualized on these frontal images. This caudate lobe has like separate venous drainage, okay, separate venous drainage via other hepatic veins which drain directly into the IVC, and they have portal venous supply from both the right and the left branches, okay. So whenever the liver is affected by some systemic disease, for example cirrhosis, caudate lobe is spared from the general disease and shows hypertrophy to compensate for the loss of function by the affected liver, okay. This difference is because of this different blood supply and venous drainage of this caudate lobe, okay. Now one question is there: the right border of liver is formed by which segment, okay. So just look at this frontal view. Actually, these segments 6 and 7 are situated more posteriorly, and they are only visible uh, from the back side only. On frontal section, on the frontal images, 5 and 8 are visualized. Hence, right border of liver is formed by segment 5 and 8. Okay. Now, let's look at the transverse sections of liver. So, this is the very superior section. So, here are the superior segments 2, 4A, 8 and 7. Okay. Next is the section taken at the level of this left portal vein. So here come both the superior and the inferior segments 2 versus 3, 4A versus 4B. But here they are still the superior segments 7 and 8. Okay. Next is the section taken at the level of right portal vein. So here we will see the inferior segments because the left lobe superior inferior division has already been taken place. And here we will see both the superior and the inferior segments. And a section at a very lower level, for example at the level of splenic vein, we can only see the inferior segments like 3, 4B, 5 and 6. Okay. The segment which is seen closely to the right kidney is the segment 6. Okay. Now how to separate the liver segments on cross-sectional imaging. Okay. So let's see the plane of the middle hepatic vein. Okay, we have to draw a line along the middle hepatic vein joining to the IVC, running across the gallbladder and the IVC. This is division of middle hepatic vein into right lobe and the left lobe. Next is the umbilic plane. So this umbilic plane, we have to extrapolate a line along the falciform ligament, and we have to reach the junction of the IVC, right and the left hepatic vein, and at this junction and along the falciform ligament, this is the umbilic plane. Okay. And next is the plane of right hepatic vein along the right hepatic vein joining the IVC up to the right lateral border of the liver. So so it is the Couinaud classification is, I think, very clear to you. The nomenclature 2, 3, 4, 5, 6, 7, 8. Okay, let's catch you there in the part 2 of this liver series.